Welcome back to Great Day Wellness Wednesday. An enlarged prostate affects about 40 million men in the U.S. alone, but less than 1/3 actually seek treatment. Our next guest has a safe and permanent solution to bring men the urgent relief they need. Dr. Sukin is with Texas Urology Specialists. All right, welcome back. Okay, let's start with what the prostate is.
So the prostate's a small gland. It's usually around a walnut-sized gland, which sits between the bladder and the urethra. As men begin to age, that prostate starts to grow, and it can continue to keep growing as men age. So around 50 years old, about 40% of men are starting to have some problems with the prostate's enlargement. And as they get into the 60s, it gets to 70%. As you get old enough, almost everybody has to deal with it.
All right. Okay, an enlarged prostate. I can imagine a lot of people making some conjecture about, oh, enlarged prostate must mean prostate cancer.
So we call it benign prostatic hyperplasia, or BPH. So it's enlargement of the prostate, and it has nothing to do with prostate cancer. So if you're having these kind of difficulties with urination and you see the urologist, they'll be checking you for prostate cancer as well as this problem together.
Okay, so urgency, increased frequency, difficulty, leakage, stream, starts and stops, waking up in the middle of the night, it really impacts your whole quality of life, doesn't it?
It really does. So as it gets worse for men, they can lose sleep. Getting up every hour at night can be quite a problem, especially when you got to get to work the next day. And it can also affect your partner. So if you're waking up all night to go to the bathroom, your partner's waking up all night as well, and you're both tired the next day.
Yeah, and I'm thinking the movie theater, a road trip, all that type of stuff, right?
Worried that the stewardess won't let you use the restroom yet. That can be a real problem.
Yeah.
And so people are mapping.
The captain has turned on this fasten seatbelt sign. You'll have to go later, sir.
That's exactly right. So, and then it can lead to leakage of urine or feeling like you're never going to get to the bathroom in time.
Yeah. Okay. If left untreated, because you know the stereotype about men is that it's just a part of aging. I'll just have to deal with it. If left untreated, what can happen?
So if left untreated, men can start developing more and more urgency, frequency. They can develop bladder infections. Men can even actually develop stones in the bladder. The bladder wall can get thickened, which causes more damage to the bladder and more frequency and urgency. And long term, some men can even develop retention where they can't go and need a catheter, and has actually led to kidney failure in some patients.
Wow, and I would imagine this is like so many other things in health. The earlier you get to it, the better.
And that's why I'm so excited to get to tell you about a new procedure, because a lot of men are afraid of what's been out there before. They're worried about sexual function changes from previous medications and procedures.
Yeah, and medications oftentimes, did they really address the problem or kind of deal with symptoms?
So a lot of them will help with the symptoms, but they don't help enough. You have to take a medicine every single day, but those medicines can have side effects such as nasal congestion, dizziness, sexual dysfunction. Others of them can cause more sexual dysfunction or even breast swelling.
You can just stop at sexual dysfunction.
Exactly.
I think a lot of men are going, okay, right. Okay, so other surgical treatments included heating, cutting, removing tissue. UroLift is something that's kind of a game changer.
So it's really revolutionary. It's the first idea to manage enlarged prostate. As the prostate enlarges, it sort of swells and blocks off the urethra. And instead of cutting it, removing it, heating it, this is just moving it out of the way. If you could imagine drapes in your dining room and you just want to sweep those out of the way, that's exactly what this device does. And we use this little lift device. And this little lift device.
How tiny that is. Yeah, hold that up again. That's super tiny.
It's very, very small.
It's amazing.
And we implant that lift device and it just brings the prostate out of the way without having to cut the tissue. With doing that, it's minimally invasive. It can be done in the office in an hour's time. The patient can be in and out in the office in 1 hour. Most patients, the majority, don't need a catheter, which is very unusual for prostate procedures. Men starting at age 45 can start getting this procedure, and the recovery is quite good.
Yeah. So how long in terms of recovery?
So most of my patients, in the first 2 days, they'll have pelvic pain, blood in the urine, urgency. They want to stick around the house. But most patients are back to their daily life and their job in 3 to 5 days, and most of the symptoms from the procedure are gone in 2 weeks.
All right. One thing that's in medicine that we should all know as patients is that not every doctor who practices a certain type of medicine does the same thing, right? People specialize in things. You all, the UroLift Center of Excellence, and so this is what you know to do.
That's correct. So the Center of Excellence is a national designation for urologists who've had expertise and significant training to perform the UroLift procedure. So I'm very excited to be one of the centers in Houston to provide that to patients.
All right, so one last push for, because I know people want to put it off and wait. It's like, don't wait, right?
Don't wait, because this is a new procedure that allows management of the difficulty in urination that men can develop, and it has no sexual side effects. And you can be back to your life in just a couple weeks.
Yeah, and I think we talked about earlier how you got 40 million and most aren't treated for it. I think it's because they don't really know about this treatment. So thank you for letting us know about this.
Absolutely, thank you for
right.
allowing us to be here.
Put on the Marvin Gaye song, and there we go. Let's get it on. Okay, for more information on the UroLift treatment for enlarged prostate, call Texas Urology Specialists at 281-247-0172. 281-247-0172. You can also visit them online at texasurologyspecialist.com.